Hello students! Today we are going to discuss epidemiology and common health indicators. For your learning outcomes, each one of you is expected to be able to define epidemiology and explain the components of its definition. Discuss the different types of health indicators and their examples. So when we talk about epidemiology, this refers to the study of the distribution and determinants of health-related states or events in a specified populations and the application of this type to the prevention and control of health problems. When we talk about epidemiology, we are always referring to the population affected, like how many people are affected with this and that, and what are the possible determinants, like the risk factors. Is there something special about a specific age group that predisposes them to a specific health concern? And at the same time, using this data to assist us and guide us in the prevention and control of health problems. Like, for example, if we are providing nursing care to the community, epidemiology or the data that we gather would allow us to know if the programs and the activities that we are doing is actually helping the population in preventing and controlling their health problems. So when we study epidemiology or when we get to know it, we need to be familiar with several terms. Like, for example, when we say study, that includes everything about research and experiments, like surveillance, observation, hypothesis testing. When we say distribution, this refers to analysis by time, places, and classes of people affected. Like, for example, what is the distribution of gender among specific age group? Like, for example, in a specific community, are there more teenagers or young adults than older people? So that refers to our distribution. We also have the term determinants. This include all the biological, chemical, physical, social, cultural, economic, genetic, and behavioral factors that influence health. Like, for example, is a specific gender predisposes a person to a specific health problems or health issue? Is there a relationship between your workplace and your exposure to specific chemicals to the type or the kind of health issues that you will be facing in the future or you are facing currently? What about the social, cultural? So these are what we call as determinants. When we study epidemiology and we get to know the determinants, this will guide us to be proactive in dealing with specific factors, like if for males, what are the predisposing conditions that would assist us to help. Like, for example, for a specific community, like their location, their behavioral practices. These are determinants that we would know influences their health, and at the same time could as well, like, quote unquote, assist us to predict no the death or the wellness outcomes. When we say health-related states or events, these refer to diseases, causes of death, behavior such as the use of tobacco, positive health states, reactions to preventive regimens and provisions and use of health services. So health-related states basically refers to anything, including disease, behaviors that could affect the health of a person. Or for this epidemiology, the health of a specific population or a specific community. Now, when we say specified populations, that include those with identifiable characteristics, like for example, by age group. So we have neonates, we have infants, we have toddlers, we have school-age children, we have teenagers, we have young adults. At the same time, we can also group them according to their civil status, according to their educational attainment. So when we refer to this, specific population groups, as well as like occupational groups, like their work, the work area, would mean that we are talking about specific populations. Or in community health nursing, we often refer to them as population groups. So when we say application to prevention and control, this is actually the aim of public health, which epidemiology is a big part of. That is to promote, protect, and restore good health. What are the different types of health indicators? When I say health indicators, that means basically that the numbers, the figures that would provide us a glimpse and would indicate the health status of a specific population. So we have morbidity. I say morbidity, that includes the prevalence and the incidence. So I say prevalence, the total number of cases. And the incidence would be the total number of new cases. So we'll be discussing that in a short while. We also have mortality. So this includes crude and specific death rates, maternal mortality, infant mortality, and so on and so forth. Or anything that causes death. No? When we say mortality, it refers to death. Population indicators. So when you say population indicators, these are age, sex, structure of the population, population density, migration, population growth. Like for example, in a specific population group, we have indicators like the age, the sex, okay? At the same time, the density, how many, what comprises this specific community? Are they more on the older adults or the young ones? So these are our health indicators. Okay, so these are our fertility rates. So when I say fertility rates, that would primarily give us a glimpse or an idea of how fast a specific community grows in terms of numbers. We have the crude birth rate, which is the number of live births divided by the mid-year population times the 1,000. Now, I would like you to be mindful of like when you are going to interpret rates. So don't forget to mention, like for example, your crude birth rate, it is per 1,000 population. So like for example, you're saying that the crude birth rate of community A is like 120 per 1,000 population. So don't forget that. We also have the general fertility rate, which is the number of live births divided by the mid-year population of women who are 15 to 44 years of age. I would like you to realize that 15 to 44 years of age are the reproductive years of a woman. We call this group as women of reproductive age, or the WARA, WRA, women of reproductive age. That means if, like for example, you would like to know the general fertility rate of a population, you would like to know what is the rate of the number of live births within this specific population of women of reproductive age. This is very important because if you're going to notice, if there are a large number of women within the reproductive age, that could somehow affect the community's fertility rate. What are the different mortality rates that are commonly identified and used? We have the crude death rate, that basically is the number of deaths divided by the mid-year population times 1,000. So this includes all, no? All recorded deaths. So it doesn't matter what cause, as long as it's death, it's included in the CDR, or the crude death rate. So when we say infant mortality rate, these are deaths under, how old is an infant? Of course, the first year of life, right? So deaths under 1 year of age divided by the number of live births times 1,000. So this is age specific. So when we say neonatal death or mortality rate, so what age of would you consider? So when we say neonates, that is how old. So you should know that. So when you say infant mortality rate, these are deaths under 1 year of age. So included in that IMR are neonatal deaths as well. So when we say maternal mortality rate, these are the number of deaths due to pregnancy, delivery, and puerperium. So when I say puerperium, that is the first 6 weeks after delivery. So you divide that, all of these deaths occurring to the mother during this period from pregnancy to puerperium, any deaths during that time divided by the number of live births times 100 would be reflected of our maternal mortality rate. So I would like you as well to realize that it is very important to know about maternal mortality rate, because this actually gives us an idea of the overall state of health of a specific community, because maternal mortality would affect not only the baby, but it would affect um, the whole family. So if there are a lot of maternal deaths, if the rate is high, we would like to check, right? What causes this? Because for every mother who dies within this period, that means one or more children orphan, right, from having a mother, and that would somehow affect, of course, the family dynamics, with the father bearing the burden of taking care of a newborn, at the same time taking care of the rest of the children and the rest of the family as well. So it's a very important indicator of health. At the same time, this would somehow, like our mortality rates, is a reflection of our health system, how we address morbidity, which, if not taken care of properly, would lead to mortality. At the same time, our fertility rate would show us, like, if there is a rapid increase in the population, that would mean, like, say for example, there would be um, a need or an increased utilization of health and other services So if, like for example, the available resources, the available services would cater to specifically only this, and there is a growth in the number of people who needs to access these services, specifically health, then we would know that it could lead to specific morbidity and eventually mortality. We also have the Swarups Index, which is the number of deaths among 50 years and over, divided by the total number of deaths times 100. So Swarups is a good indicator for um, how we deal with chronic diseases. Like for example, it would somehow provide us an indicator as to um, how our healthcare, specifically towards 50 years old and above, is being utilized. Because we all know as a person ages, he or she is more prone to a lot of diseases because of the normal and sometimes the um, influence degeneration of the body. So it's very important to know about Swarups index. When you say case fatality rate, this is the number of deaths from a specified cause divided by the number of cases of the same disease times 100. So like for example, we would like to know what is the case fatality rate of hypertension. So we would like to know how many people died from hypertension divided by how many people um, is recorded to have hypertension. And that would give us a glimpse. So for example, if we compare the case fatality rate of the previous years up to the current years, and if we see an upward trend, maybe we would like to review and reassess our healthcare interventions, specifically in the community. Why is there is an increasing number or an increasing rate of deaths from hypertension and what we can do. Okay, so basically, case fatality rate is actually an indicator of the utilization of healthcare services and the provision of it. How effective is the provision of healthcare towards this specific population affected by specific disease or condition? Okay, so when we say morbidity rates, we have the incidence rate and the prevalence rate. When we say incidence rate, this is the number of, I would like you to know, number of new cases of disease developing from a period of time divided by the population at risk of developing the disease times 100. So when you say prevalence rate, that is the number of old and new cases of a disease divided by the population examined times 100. So for example, like this is very good indicator for chronic diseases like the prevalence. So when we have like for example diabetes, we know that diabetes is a chronic condition. Once you have that, you cannot expect it to be gone in a matter of months. It would be like they would say you have to deal with it for the rest of your life. So we would like to know if like the previous years and at this point in time, is there an increase in the prevalence, no? Old and new cases, because let's say for example, 2018 cases of diabetes. Of course, right now they are still included in the 2020 number of cases because they still have um, diabetes. And if, like for example, the number of old cases plus there is an increase in the new cases, your prevalence rate would have an upward trend. Incidence rate at the same time is also good because this would allow us to assess as well, like what I have said, how healthcare is provided to this specific population. Incidence rate is a good indicator specifically if we are dealing with communicable diseases. Communicable diseases usually are acute diseases. They most of these diseases do not last for more than 6 months. So you would like to know for this specific period of time, like for a year, is there an increased incidence of like dengue? Okay, so how is that? We would like to know if the incidence rate of dengue is actually increasing over the years, because that means what we are doing to address dengue is not doing what it's supposed to do. So we can further check on our programs and our activities. And we would like as well to know the timing. Like for example, before we considered dengue as a seasonal issue during rainy seasons, but now this is a year-long threat to everyone in the community. So you would like that we would like to know that because our health programs and interventions wouldn't just like be for a period of time. Maybe we can do it like regularly. So please don't confuse yourself with the incidence and prevalence rate. So the prevalence rate is actually a very good indicator of healthcare utilization for chronic health conditions. That's it, students, for your epidemiology and common health indicators. Please read your book for more inputs and learnings. Thank you.